Running a veterinary clinic shouldn't feel like constant chaos, but for so many of us, it does. Your schedule's off the rails, you have misaligned teams, and the endless stress can make every day feel like an uphill battle. But what if it didn't have to be that way? In this episode, we're sharing the secret to a stress-free clinic. Practical tips to streamline your operations, reduce stress, and deliver the best care for your patients. If you're ready to make life easier for your team and yourself, stick around. Let's get into it.
All right, Dr. Siegel. So we are going to talk about several different things, practical things that vets can do to streamline their practice that can reduce any unnecessary stress in this segment. So I want to ask you 3 specific things.
Okay.
All right. So first up, daily huddles. How can something like a little huddle, a debrief, rounds, how can that improve your practice?
This is one of my favorite ones, and actually one I actually have some passion around daily huddles. I think this should be a thing. So I think also that clinics find this hard to do, and I understand that, but like, why does it have to be so hard? These huddles just are a way to sort of set the strategy of, and you can even have maybe 2 a day or whatever, a morning one and an afternoon one, depending if you're having a new staff member come in, like techs come in that are doing afternoon shift or whatever. But it really sets the strategy for the morning or afternoon or the whole day. And it only has to be like 5 minutes. Yeah. And I know it's hard to take a breath and, stop everything, but that short time of investment like makes such a big deal for your day. It's a time to kind of ask everybody where they are, where they need any support or help, where they need to, just have a few moments to like kind of reset what everybody's doing. And I just love that it just takes that moment to get everybody on the same page, particularly if someone's kind of drowning and needs some help, and be like, well, I'm drowning back here. Is there someone that can maybe help me with this? Or, we have these drop-offs coming or these pickups coming, whatever. It's just a great way to reset.
And I love that. I love that it's not just rounds like about patients, but it's also checking in with your staff. Exactly. And this is what we're going to do today. These are the plans, or hey, we've had a lot of bad cases lately. Is everyone okay? Like just little check-ins like that. I love that.
Yeah. And it's your strategy for how you're going to tackle everything, or knowing what's coming. Like this is going to come later. The other thing I think is really good about it is that it allows people to, say things that they might, like things that are bothering them or something that's going on. Not like a big conversation about like an issue everybody's having, but if it's like a small thing that someone needs to just say like, I'm struggling with this, or I'm this happened or whatever, that it doesn't brew in that person. It allows your team to like let it out and kind of, say what they need to say. So they're not like brewing on it and then it explodes into something bigger later. So
love that. Yeah. Now I want to ask you about the treatment area, the procedure area, and how that can align with the front desk. What are things that we can do to make sure that everyone's on board?
Yeah. And that's a key area too, right? Because that lack of communication between sort of front and back can really bottleneck a team and cause a lot of frustration. So I think those huddles are helpful for that, and making sure that it's okay for like your client service coordinator, front desk person can come back and like communicate with the team and feel comfortable doing so. I think practice managers are helpful here too, because they're kind of the runner. They know what's going on in the front, they know what's going on in the back, and they can kind of help with that, relaying the communications there. I also really believe in a treatment board, like having a whiteboard or whatever you guys can use. Have a treatment board on there that has, the pet's name and kind of some detail on there of like when they're due to go home, what like they have take home RX or whatever, so that if someone from the front's coming back to get a pet, they're like, oh, that one's going to be ready, or they get a call and they're like, is my pet ready? They can be like, oh, no, they'll be ready at 3, so they don't have to actually come to a person. They can be like, oh, it's right there.
I love that. And I always say we need like 3 people. It needs to be done at least 2 or 3 times so that everyone's checking up on everyone. So like you said with the whiteboard, yes, they could have the pet marked ready to go. They can have all the medications and stuff, but then you have another way of making sure that, okay, this got done, this pet's ready to go.
Yes.
So I don't have to stop and ask anybody else. Like I can see that. Of course, I always do like a verbal confirmation.
Right. Just to
but
check.
yeah, but no, I love that. And making sure, okay, box ticked, we're good.
They're done. Yeah.
Now let's talk SOPs, our standard operating procedures. What's the key to creating simple SOPs that your entire team will actually follow? And how do you present that to your team?
Yeah. From my perspective, I feel like, first of all, knowing the challenges of your particular hospital or practice, because it's going to be different for everybody. So if there are like pain points that keep coming up, so I'm starting with like defining what you need an SOP for. And so if there's like constantly questions coming up about something, or you're seeing or can foresee something being an issue because you guys know your teams, like defining what those challenges are and then creating them. To your point, and your question is keeping it simple is key. Super straightforward, very simple for team members to like know, but also remember, and that it's not complicated. So it's super easy to understand. I think some helpful ones that I have had in the past have been how to schedule appointments. So especially if you have new staff. Having a just an outline of what types of appointments are for what segments of time, questions to ask owners when they are on the phone so that they can help triage or understand what the actual problems are.
Yeah.
And we used to have just like a list of questions that are always there to ask. And it could make a difference of an appointment being, oh, this is just a vaccine, to this was a vaccine and a wound management problem, so it can really make a difference in how that appointment goes, and then subsequently your entire day, because if that gets bogged down with the wrong triaged or appointment, then you're kind of done. So I think those are really helpful.
Yeah. In a stress-free clinic, everyone knows exactly what they're responsible for. But what happens when things get messy and the lines blur? In this segment, we're putting each other to the test. We'll take turns presenting tricky scenarios from a busy vet practice, and the other person has to decide which role should step in and fix the problem. We'll cover 4 scenarios, so we'll have 4 chances to show how clear roles can turn chaos into calm. Here we go. All right, Dr. Siegel, you are up first.
Okay.
So it's the clinic's busiest day of the month coming up, and the surgery schedule was double booked. Who's responsible for fixing this problem and notifying clients?
Yeah, that's that you just saying that, I'm like, oh,
I know. It makes me cringe too.
So I think this is going to be a multi-person kind of tag team. So I would say first it's like reception working with the doctor first to see what, because of course everybody wants to try to accommodate where you can. So talking to the doctor and being like, this is happening, and then trying to work out, is it possible to still like to shift things around in the day to accommodate, is always, obviously the best way around it. But if you're short staffed, or, you don't have the ability, maybe you're just one doctor and you're like totally swamped, then it would be the receptionist being able to call the client, explain to them, but offering a solution first, rather than just saying, oh, sorry, we can't accommodate you, but always trying to problem solve and offer solutions for them, or choices that they can have. Maybe another pet could be a drop off and then have more time for the procedure. So just kind of thinking problem solving and like adjusting to try to make the choices be really good for that client.
Yeah, absolutely. I think in those scenarios too, it's always good, especially depending on how bad the mess up actually was, like you said, offer solutions, obviously we're going to offer apologies. But even that might be, we're so sorry, we're going to get you a 10% discount, because of your troubles. Like, we really apologize. We just want you to have the best experience, and you wouldn't on this day.
Right.
So I think that's a big part of it too.
Yes,
and for instance, I've even had a client that similar scenario, and emergency came in, and I was like, we've got to push this one. Like, this one's an annual.
Yes.
And very nice client. They said, absolutely no problem. We also ended up having one patient pass that had insulin left over, wanted to donate that. Guess who we ended up giving it to? That guy.
Yeah,
So it just, comes full circle, just trying to help out.
All right, Dr. Terrell, it's your turn. A pet owner insists on staying with their dog during a procedure that's typically performed without a pet owner in the room. Who's responsible for explaining the clinic's policy and managing that situation?
Oh yeah, this happens a lot.
Yes.
So I think it definitely varies by practice, but for the most part, I think that either the practice manager or reception is going to field that interaction for the most part, because they're usually in those scenarios, they're probably dropping off or supposed to be dropping off anyways, or like you said, checking in and then leaving to come back later. So typically for us, we would be either reception or a practice manager, sometimes even your vet assistant or vet tech. I will say, if the owner is just not having it and they want it's just not going well, then a lot of times it would be either the veterinarian and or practice owner in that scenario. That happens to be the roles that both me and my partner have, because we're both vets and we're both partners. So if there was ever an issue, like if they just said, no, I want to stay, then we would talk to them about it. But I will say, if it came too much of a problem, we'd just be like, okay, but you're going to be waiting out here for a while.
Yeah, I agree with that. I think in general with things like this, like a practice manager or receptionist, getting sort of the first piece of explanation, and if it gets too much, to you then go in and have the vet come out. But I think it's critical that a team understands that it's not always just going to the vet and having the vet come out and explain everything, because I think sometimes they may feel like, that'll get the problem solved real easily, and may not have the confidence to be like, I can actually make a difference here. So, and having them do that more, they'll get that, they'll sort of have that sort of authority voice that they should be owning.
I think that it's the reason why I like reception and or the practice manager to address those issues as much as possible, is because it's more of a clinic policy. It's not trying to take the vet and the vet techs out of those situations to where it's more policy stuff, protocols driven.
Yes.
Then, that's, let them focus on the patient, and the practice manager focus on how to manage the practice.
Exactly. Yeah. And I think that's a huge clarity piece of like making sure that there is that difference, like the vet team focusing on the medicine part as much as possible, and that understanding, because those lines get blurred a lot, I think. Yeah. And, people will just run to the vet.
All right. Back to you.
Okay.
A critical piece of diagnostic equipment is on the fritz. It has gone down and everyone's panicking. Who is responsible for finding this quick solution? We say quick, but how about solution for minimizing disruptions?
Yep. So obviously keeping equipment in their top shape is going to be important. And there are tools out there that are available that help you do that, to keep maintenance for your equipment top shape and very easy and efficiently. But if you don't have that system to keep it on track, I would say it's helpful to have technicians that are sort of like the leader for certain things. So whether it's like someone is a lead for the equipment, and then you have a lead for inventory, you have a lead, so there's certain responsibilities to define for technicians. So it depends on what it is. I would say it's a technician, maybe receptionist kind of tackle. And also depending on what's happening in the clinic at the moment and where you're sort of needing your staff to be to be placed. So but yeah, I think having that person who's a lead and knows, oh, the numbers are all here. I know where that is. With that said, there should be a lot of cross training so that if that one person isn't there, there is someone else. So having people know where the list of phone numbers are and how to do that. All right, last one. During a busy afternoon, a tech and a vet give conflicting instructions to the front desk about when a client's pet will be ready for pickup, who's responsible for ensuring clear communications between the team.
That's great because it happens. It happens more than we probably like to admit. I think that either reception or your practice manager, ours is both. So my practice manager is also our lead receptionist. She's going to be the person who typically is going to come find us, the vets, and say, hey, I was told by one we're leaving at 3. So by another one, it's 4:30. Which one is it? And, in the end, typically it's going to be the veterinarian who's going to have the say-so, and it's their, patient. They're going to make sure that everything's going to go well with that and with their discharge. So typically reception and or your practice manager to make sure things are being done how they should.
Right. Yeah. Love that. Treatment board's helpful for that too.
They do. Yep.
As long as that time is confirmed by everybody and when you put it on there.
And standard operating procedures. Yes. So, yep.
The show is brought to you by MWI Animal Health. Running a stress-free clinic starts with reliable systems, and MWI makes inventory management seamless. From automated reordering to real-time tracking, they help you eliminate chaos so you and your team can focus on patients. Learn more at mwiah.com.
Running a stress-free clinic is all about finding the right solutions for the challenges you face. Sometimes technology can make life easier, but other times the manual approach works better. In this segment, we're testing that balance. We'll present real-life clinic scenarios, and the other person has to decide, is technology the answer, or should you stick to the human touch? Let's get into it. Clients complain that they're always on hold trying to book appointments. Should technology solve it with an online scheduling tool, or should the front desk improve their phone processes?
Yeah, so this is 100% technology can be the alleviator here. So online booking is incredible. It allows clients to book at the comfort of their home, convenience whenever they want. They can sit and look at the calendar and decide what appointment to do instead of like being on a phone with someone where you're like sitting waiting for them to check their calendar. So I think it helps a lot. So online scheduling tools for sure, two-way texting, mobile apps, like all of those things are really going to be helpful to alleviate a lot of the those like long phone calls, tying up a receptionist, being on the phone, having them free to be doing other things, and just overall efficiency.
I do have a follow-up question for that, because I know I get nervous about online scheduling they'll book for, it's the same when they call too, but because you can't have that feedback and asking questions like, oh, well, has there been any issues? Because I see where you scheduled for an annual, and then they come in, they said, yeah, it vomited 5 times yesterday. Yeah. So does that, are you worried with online scheduling tools like that, kind of disrupting the flow of practice in those scenarios? Or do you think it's going to happen regardless, whether it's made from online scheduling or on the phone?
Yeah, I think that when the online scheduling, you can confirm, confirm through a call to the owner or a two-way text or something to be able to confirm what is going on with the pet and that they did put in the correct information. So there is a piece of like confirming that. Gotcha. And I think that's an important part of that.
Gotcha.
Okay, so what about you're not getting enough feedback to improve client experiences? So how do you feel about technology solving this with digital surveys, or should you implement a manual feedback process?
I love both, actually. So digital surveys are great, but if I found that if you often give owners the option, especially survey wise, they're probably not going to do it unless they're just super interested or super bored. Right. So I think that having a mix of both, having, something at, like you said, at checkout, that'd be great because they're right there. They're, it's very quick and easy. I know when I'm out and about and they have a survey at the end of something, like how would you rate your experience today?
Yeah.
Boom,
Yeah.
got it. So I think that's super easy.
Yeah.
But a combo of both would be nice.
Do you feel like, so I agree with you. I think right at the finishing of the appointment, it's like fresh in people's minds. How do you feel about people leading the survey? Like, please give us 5 stars on your review today, that kind of thing.
Yeah.
Or we get rewarded if we get 5-star, that kind of thing.
I don't like that. I would say in the scenario where it's, if you were really satisfied today, we would love a 5-star review. If you were unsatisfied with your visit today, we would love to hear what we could do better to improve your visit. So I like that scenario. I don't like necessarily fishing for a 5-star review because that just seems like, I don't know, skeezy.
Yeah.
Like, okay, like so we can make us look all super and whatnot. Because I think that if your practice is doing a good job, if they are reaching out to clients and pets and doing all the things that they should do, that clients are going to do those ratings and you don't have to ask for them.
Right.
So, okay, next one. The team struggles with staying on the same page during busy shifts. Should technology solve it with a clinic-wide messaging app such as Slack or some other form of messaging like my clinic does Snapchat? Or should the team rely on more frequent like in-person check-ins?
Well, I am a fan of the huddle, as I said earlier. So I do like that. I realize it's a one moment thing and there might be, messages you need to send at other times. I think having technology tools to help with that is really, really helpful and important to have. So for those like in moment type of messagings that you need to do, and there's technology for that you can have on your desktop. I think the worry about having it on your phone is then having people be on their phone constantly. So there's some trade-off there. It also depends on how big your clinic is. So you may not need like a clinic-wide thing like that. But I like the in-person check-ins. And if you have technology that you're able to have on your desktops, that if someone's doing notes and you see things pop in, I think that's really great.
I like that.
So here's the last one. Clients are frustrated with long wait times. Should technology solve this by implementing a digital queue tracker or should staff focus on improving workflows manually?
I am my own digital queue tracker. I feel like my receptionist is also her own because it's like hey, so-and-so's been waiting for 20 minutes, hurry it up back here. So I don't think that that's necessary to have. I think your staff is pretty quick to tell you you're taking a long time, hurry it up. We've got clients that are getting mad out here. So I think just focusing on improving workflows. Why is there a wait? Is it because we had a miscommunication in scheduling, whether that be that the front desk didn't schedule the appropriate times based on what it was there? Was it that the client surprised you with a problem that the pet had whenever it wasn't scheduled for that? And, those sorts of, or did we have an emergency? Do we have a drop off? Is that why we're behind?
Yes.
So I think just, the staff focusing on why the workflow is interrupted and how to improve it, or if it was just something that was out of our control.
Right. I totally agree with that. I feel like when when a client's there, like, when you're told a client's here to pick up, so-and-so, that
You can feel their eyes through
I was
the
just
walls.
going to say, like,
Yeah,
how long
you know.
they're waiting.
You know.
So, but it doesn't help the situation that, you still have to, but to your point, knowing what is that bottleneck or what is that workflow issue that's happening to try to prevent those from happening.
Yeah. And if you can't feel their eyes, you can hear their sighs.
Yes. If you're enjoying the show, one of the best ways to support us is by leaving a rating on Spotify. Here's why it matters. Spotify is one of the biggest platforms for podcasts, and your rating helps us reach more people who care about running stress-free, successful veterinary clinics. It only takes a few seconds. Just search for The Vet Reset on Spotify, tap the 3 dots, and then tap Rate Show. Your feedback doesn't just help us, it helps other veterinarians find the tips and insights they need to help their practices thrive. So if you've gotten value from today's episode or any other episode, please take a quick second to leave a rating. It really does help the show out a lot.
Running a stress-free clinic often means taking a hard look at the way things are done. Some habits and processes make life easier. Others just add to the chaos. In our next segment, we're evaluating common clinic processes and deciding whether to keep them as they are, make some changes, or cut them completely. Let's get into it. All right, first up, allowing walk-in appointments. Cut, keep, or change?
I'm going to say keep for emergencies.
Okay.
So in general, not a huge fan of walk-ins for just random whatevers, but obviously emergencies will take priority. But I feel like walk-ins are the first thing that'll take down a day and take down your team.
And push everybody behind.
Yes. Yeah. So I'm going to say cut general walk-ins.
Yeah.
All right. Next up, on-call hours for emergencies.
So for small animal, cut. There are emergency only practices out there that is what they're for. If you're working general practice, you have your set times. And I think that after that, you need to be able to go home and relax.
Yep.
And you need to be able to just be at home and not have to constantly worry. I mean, I have been through that scenario. Now, obviously, that's not the same for mixed animal or large animal vets. They have to be on call for emergencies in those scenarios, calving season, colic, you name it. But I do think that it needs to come with a good schedule, a good set boundaries. I know, we even set boundaries on times, like we'll answer the phone from this time, and then if it's after 2 a.m., you're going to have to wait until 6 or 8 or whenever. Right. So small animal, cut it. Large mixed animal, yes, but let's get better about setting boundaries.
Yeah.
Next up, drop off appointments.
Ooh.
Cut, keep, or change.
Oh, keep those.
Yeah.
Yeah. Love drop offs. I will keep those. Those drop off appointments, I think, are key to having a smooth running day. Having people do drop offs for your annuals, vaccines, kind of like routine things, is really key to keeping that appointment schedule nice and tight and clean, and also alleviates a lot of the pressure then on the team, so you can be doing things in parallel. So if it's even if it's like a rewrap bandage or something, someone else can start it while you're in a room, and then you come in and finish something. So it's just a really great efficiency tool.
I love that too. And I think that it kind of even goes back with our walk-in appointments. So instead of having a client wait there for hours or however long it may take, sorry, we'd be happy to try to work your patient in. Would you allow us to keep your patient here? You drop them off. We'll work them in when you can, and then we'll give you a call.
Yep.
And then if there's any issues or questions or anything, it's just a phone call away to get some answers. But yeah, that allows you to not have the stress of having all your walk-ins waiting in the lobby. And then you can do it and say, hey, somebody no-showed. All right, we got 2 drop-offs in. Let's get to those. So
yeah, love it. Last up, flex schedule for employees. Cut, keep, or change?
Keep.
Okay.
If we are going to keep our employees happy, we have got to be able to be flexible with our schedules. This is all about keeping everyone feeling good and working hard. And if they are able to have a schedule that makes them happy, you are going to have better outcomes and you're going to have a happier staff. Things are going to be able to just mesh a lot better together. And you can always, look and see where some gaps may need to be filled at certain points of the day, because maybe you're super busy in the morning, but not in the evening. Then you can arrange that and get certain, employees to fill that role.
Yes, totally. Love that too. I totally agree. And it also, everyone's got different things going on in their life. So it allows people to be able to like come in at certain times that works for them. And to your point, makes everyone happier. So love it. Remember, great care starts with great systems, and empowering your team unlocks the full potential of your practice. Until next time.